Hi everyone, get ready for expert tips, practice questions, and clear explanations, all designed to make your NCLEX journey smooth and stress-free. Subscribe now and let's make NCLEX success easy together. Question 31. A nurse is providing instructions to a client taking Warfarin. Which statement by the client indicates a need for further teaching? A. I will have my INR levels checked regularly. B. I should use a soft bristle toothbrush. C. I will increase my intake of green leafy vegetables. D. I should avoid contact sports. Answer. C. I will increase my intake of green leafy vegetables. Rationale. Green leafy vegetables are high in vitamin K, which counteracts Warfarin's effects and increases the risk of clot formation. Clients on Warfarin should maintain a consistent vitamin K intake. The other statements demonstrate proper understanding. Question 32. A nurse is caring for a client receiving magnesium sulfate for preeclampsia. Which assessment finding requires immediate intervention? A. Deep tendon reflexes of +4. B. Respiratory rate of 10 breaths per minute. C. Blood pressure of 140/90 millimeters of mercury. D. Urine output of 40 milliliters per hour. Answer. B. Respiratory rate of 10 breaths per minute. Rationale. A respiratory rate below 12 indicates magnesium toxicity, which can lead to respiratory depression. The nurse should stop the infusion and administer calcium gluconate if necessary. Hyperreflexia +4 is expected in preeclampsia, while a blood pressure of 140/90 and urine output of 40 milliliters per hour are not immediately concerning. Question 33. A nurse is caring for a client with a suspected stroke. What is the priority assessment? A. Blood glucose level. B. Oxygen saturation. C. Pupillary response. D. Level of consciousness. Answer. B. Oxygen saturation. Rationale. Ensuring adequate oxygenation is the priority in stroke management to prevent further brain damage. Blood glucose should also be checked, but hypoxia is the most immediate concern. Question 34. A nurse is preparing to administer packed red blood cells, PRBCs, to a client. Which action should the nurse take? A. Warm the blood before administration. B. Infuse the blood over 6 hours. C. Use a 22-gauge IV catheter. D. Verify the blood with another nurse before administration. Answer. D. Verify the blood with another nurse before administration. Rationale. Blood products must be verified by 2 nurses to prevent transfusion errors. Blood should not be warmed unless specifically ordered, must be infused within 4 hours, and requires an 18 or 20-gauge IV catheter. Question 35. A client with chronic obstructive pulmonary disease, COPD, is receiving oxygen therapy at 4 liters per minute via nasal cannula. The client becomes drowsy and confused. What is the nurse's priority action? A. Increase the oxygen flow rate. B. Reduce the oxygen flow rate. C. Place the client in the supine position. D. Encourage deep breathing exercises. Answer. B. Reduce the oxygen flow rate. Rationale. Clients with COPD have adapted to high levels of CO2, and excessive oxygen can suppress their drive to breathe. The nurse should lower the oxygen rate to maintain oxygen saturation without causing respiratory depression. Question 36. A nurse is assessing a client with acute pancreatitis. Which laboratory value should the nurse expect to be elevated? A. Hemoglobin. B. Lipase. C. Sodium. D. Albumin. Answer. B. Rationale. Lipase is an enzyme released by the pancreas and is significantly elevated in acute pancreatitis. Hemoglobin levels are not directly affected. Sodium levels may decrease due to fluid shifts, and albumin is more related to nutritional status. Question 37. A client diagnosed with hypothyroidism is prescribed levothyroxine. Which statement by the client indicates an understanding of the medication? A. I should take this medication at bedtime. B. I need to take this medication on an empty stomach. C. I can stop taking this medication once my symptoms improve. D. I should take this medication with an antacid to prevent stomach upset. Answer. B. I need to take this medication on an empty stomach. Rationale. Levothyroxine should be taken in the morning on an empty stomach to enhance absorption. It is a lifelong medication and should not be stopped abruptly. Antacids can interfere with its absorption. Question 38. A nurse is caring for a client with a C5 spinal cord injury. Which complication is the most life-threatening? A. Pressure ulcers. B. Autonomic dysreflexia. C. Urinary retention. D. Muscle spasms. Answer. B. Autonomic dysreflexia. Rationale. Autonomic dysreflexia is a medical emergency caused by an exaggerated sympathetic response to stimuli, leading to severe hypertension, bradycardia, and possible stroke. Pressure ulcers, urinary retention, and muscle spasms are concerns, but not immediately life-threatening. Question 39. A nurse is teaching a client about Metformin for type 2 diabetes. Which instruction should the nurse include? A. Take this medication on an empty stomach. B. Avoid drinking alcohol while on this medication. C. This medication may cause low blood sugar. D. You should stop this medication if you become pregnant. Answer. B. Avoid drinking alcohol while on this medication. Rationale. Alcohol increases the risk of lactic acidosis when combined with metformin. The medication should be taken with meals to reduce gastrointestinal side effects. It does not typically cause hypoglycemia and may be continued during pregnancy if approved by a provider. Question 40. A nurse is preparing to administer an intramuscular IM injection to an adult. Which site is the safest for administration? A. Dorsogluteal. B. Ventrogluteal. C. Deltoid. D. Rectus femoris. Answer. B. Ventrogluteal. Rationale. The ventrogluteal site is the preferred IM injection site for adults due to its distance from major nerves and blood vessels. The dorsogluteal site is not recommended due to the risk of sciatic nerve injury. The deltoid is used for smaller volumes, and the rectus femoris is less commonly used in adults. Let's know how many questions you answered correctly by dropping it in the comment section below. Please subscribe, like, and share. We love you.